Most people don't realize it, but pancreatic cancer is now one of the most lethal cancers in the world. It quietly surpasses breast and prostate cancer in death rates in many countries, and yet hardly anyone talks about it. That silence, it's costing lives. But here's the good news. Early warning signs do exist. In fact, research shows that many symptoms appear months before diagnosis, if you know what to look for. In this video, we're going to reveal 8 early signs of pancreatic cancer that often get dismissed as minor issues, but could be the body's quiet plea for help. If this video helps even one person catch this disease early, it's worth it. So please, hit the like button, subscribe to our channel, and share this with someone you care about. Let's start with one of the first things to go unnoticed: your digestion. Digestive troubles that don't go away. Your pancreas helps break down the food you eat, but when something's wrong, like a growing tumor, that process can start to fail. You may feel full after just a few bites, experience frequent bloating, or struggle with nausea even on an empty stomach. But the biggest red flag? Changes in your stool. If you start seeing pale, greasy, or unusually smelly stools, don't ignore it. That means your body isn't absorbing fat properly, a classic sign of pancreatic trouble. These symptoms may seem small, but together they paint a bigger picture. And that picture could be pointing to something more serious: fatigue that feels different. We all get tired, but this isn't ordinary tiredness. This is a deep, bone-level exhaustion that sticks with you even after a full night's sleep. Pancreatic cancer demands an enormous amount of energy from your body. It competes with healthy cells for nutrients, slowly draining your strength. Suddenly, walking across the room or climbing stairs feels like a major effort. You feel worn down in both body and mind. This kind of fatigue is often brushed off as aging or stress, but when it's constant, worsening, and unexplained, it's time to pay attention. 3. Fevers and chills that come and go. If you've been experiencing episodes of low-grade fever or unexplained chills, especially alongside night sweats or discomfort, don't just blame a virus. Pancreatic cancer can cause inflammation and immune responses that result in irregular temperature spikes. These fevers may come and go, but they don't really go away. And they're often a sign your body is fighting something serious on the inside. 4. Unexplained blood clots. This one surprises people. Pancreatic cancer is known to increase the body's tendency to form blood clots, especially in the legs. You might notice swelling, redness, tenderness, or warmth in one leg. This could be a deep vein thrombosis or DVT. Even scarier, if a piece of that clot breaks off and travels to the lungs, it can cause a pulmonary embolism, which can be deadly in minutes. Blood clots can seem random, but if you're otherwise healthy and one appears without explanation, your doctor may want to investigate further. Swelling around the gallbladder or liver. Sometimes pancreatic tumors block the bile duct, a narrow tube that carries digestive fluid from the liver to the small intestine. When that happens, bile backs up. The gallbladder can swell. The liver too. These internal changes might not cause immediate symptoms, but doctors can often feel them during a physical exam or see them in an ultrasound. So if a doctor mentions an enlarged gallbladder or liver without a clear reason, ask whether further tests are needed. Gas and bloating that lingers. A little gas or bloating after a meal? Normal. But when it becomes constant, uncomfortable, and doesn't improve with antacids or dietary changes, it could be something more. Tumors near the pancreas can interfere with digestion and press against nearby organs, creating persistent bloating or a sense of tightness in the stomach. It's especially worrisome if you start feeling full very quickly while eating, even when you haven't had much. If that feeling sticks around for weeks, don't write it off as aging. It could be an early clue. 7. Tummy or back pain. This is one of the most common, but most easily misread signs. The pain often starts as a dull ache in the upper abdomen. Over time, it may wrap around your side and settle in your back. It's not usually sharp. It's more of a nagging, gnawing sensation that's worse after eating or when lying flat. If you've had persistent abdominal or back pain that doesn't respond to usual treatments, this could be your pancreas trying to tell you something. 8. Dark yellow or brown urine. Here's a surprising clue. If your urine suddenly turns dark yellow, brown, or even tea-colored, even when you're drinking enough fluids, it could mean bilirubin is building up in your body. That happens when bile flow is blocked by a tumor, causing a condition called jaundice. You may also notice yellowing in your eyes or skin, but urine color changes often come first. So don't ignore that warning sign in the toilet. It could be an early signal that something's not right inside. Pancreatic cancer is so dangerous not just because it's aggressive, but because it's quiet. It whispers, not shouts. But if you know what to listen for, if you notice the bloating that won't go away, the fatigue that doesn't lift, the odd changes in digestion or urine, you give yourself one of the most powerful weapons in the fight: time. Time to get checked, time to act, time to live. If you found this video helpful, don't keep it to yourself. Share it with someone you care about. Like the video to help more people see it, and subscribe to HealthSense 60+ for honest, life-saving health content. Because sometimes, awareness is the first step toward survival.